أعزائي طلبة المرحلة الثانية، السلام عليكم ورحمة الله وبركاته. اليوم محاضرتنا عن الأبدومن. The abdomen is the region of the trunk that extends in between the diaphragm above and the inlet of the pelvis below. So this is the abdomen in pink color, and it extends in between the diaphragm above and the inlet of the pelvis below. The abdominal cavity is larger than its wall, larger than the anterior or lateral abdominal wall. In this coronal section, we can see this is the extent of the abdominal cavity, and we can see how it is larger than its wall. We can appreciate that the upper abdominal viscera is protected by the lower thoracic wall. We can see that the liver and the spleen and the stomach is protected by the lower thoracic wall, or protected by the lower ribs and their cartilage. Also, the lower abdominal viscera, this is the colon, part of the large intestine, part of the small intestine, is protected by the pelvic wall. Abdominal planes, these are imaginary plane. Imaginary plane are used in practice to describe the position of the abdominal organ or vessel. From this plane, we have vertical plane. Vertical plane. First of all, the midline plane. Midline plane passes through the xiphoid process of the sternum and the pubic symphysis. The midclavicular plane, these are in black color. Midclavicular plane or paramedian plane passes through the midpoint of the clavicle, crosses the costal margin, this is the costal margin, crosses the costal margin just lateral to the tip of the ninth costal cartilage, and inferiorly passes through the point midway in between the anterior superior iliac spine and the pubic symphysis. We have another plane, which is the horizontal plane that passes horizontally, the transpyloric plane. The transpyloric plane lies midway in between the suprasternal notch and the upper border of the pubic symphysis. It lies at the level of the first lumbar vertebra, L1, and it meets the costal margin. This is the costal margin. It meets the costal margin at the tip of the ninth costal cartilage. What are the structures at the transpyloric plane? That is at the level of the L1, hilum of both kidneys, origin of the superior mesenteric artery, which is the artery of the midgut, termination of the spinal cord, neck and adjacent body and head of the pancreas, confluence of the superior mesenteric and the splenic veins to form the portal vein, and the pylorus, which is inconstant at this level. This is a schematic drawing of the structure that lies at the transpyloric plane. We can see that these are the kidneys. These are the hilum of the kidneys. الهايلم معناها بالعربي هي السرة أو مكان دخول الأوعية الدموية وخروج الحالب. Pancreas, the end of the spinal cord, يعني نهاية الحبل الشوكي, end of the spinal cord. We can see in this transverse section. These are the hilum of both kidneys, the end of the spinal cord. This is the pancreas, the hilum of both kidneys. Another horizontal plane is the subcostal plane. This is the costal margin. هذه هي الcostal margin. This is called subcostal plane. Is a line joining the lowest point of the costal margin. It lies at the level of L3, third lumbar vertebra, passes through the origin of the inferior mesenteric artery from the aorta. Inferior mesenteric artery is the artery of the hindgut. and the third part of the duodenum. Another important plane is called supracristal plane. Supracristal plane. This is the iliac bone or the ilium. This is the upper curved margin, which is called the iliac crest. Supracristal plane joins the highest point of the iliac crest on each side. It lies at the level of the fourth lumbar vertebra, L4. Marks the level of the bifurcation of the abdominal aorta، يعني انقسام الشريان الآبار إلى two common iliac arteries. Two common iliac arteries at this level. The supracristal plane on the posterior abdominal surface. This is a posterior view. هذا هو supracristal plane. Is used to perform lumbar puncture. Lumbar puncture معناها عملية سحب السائل الشوكي. At the level of the L3, L4. ليش نختار L3, L4 or L4, L5, L3, L4 or L4, L5 in between them, which is safe below the termination of the spinal cord. لأنه احنا قلنا the spinal cord it will end at the level of the Transpyloric plane at the level of L1. Here in between L3, L4 or L4, L5 we can pass a needle to the spinal canal to draw a sample of cerebrospinal fluid. Another horizontal plane is called intertubercular plane. Intertubercular plane means joins the tubercles of the iliac crest. These are the iliac crests, just 5 centimeter posterior to the anterior superior spine. We have what we call the tubercles, iliac tubercles. Intertubercular plane will joins the tubercles of the iliac crests. Lies at the level of fifth lumbar vertebra, L5. And it indicates or just above the confluence or the fusion of the common iliac veins and marks the origin of the inferior vena cava، يعني بداية الوريد الأجوف الأسفل at this level. The interspinous plane, another horizontal plane called interspinous. Interspinous plane joins the centers of the anterior superior iliac spine of the iliac crest. This is the ilium. This is the upper curved margin, which is called iliac crest. Its anterior end is called anterior superior iliac spine. The plane that joins the two anterior superior iliac spine is called interspinous plane. Passes through either the lumbosacral disc or the sacral promontory. Sacral promontory, this is the prominent part of the first sacral vertebra, or just below them, depending on the degree of the lumbar lordosis or sacral inclination and curvature. Another important plane is the transumbilical vertical and horizontal plane. These planes pass through the umbilicus. It will divide the abdomen into 4 quadrants. These are the quadrants of the abdomen. So we have right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. By the use of 2 vertical plane and 2 horizontal plane, 2 vertical plane which are midclavicular plane, right and left, and 2 horizontal plane which is the subcostal plane and the intertubercular plane, we can divide the abdomen into 9 regions. 3 central and 3 on the right, 3 on the left. This region, epigastric region, right and left hypochondriac region, central or umbilical region, right and left lumbar region, hypogastric region or suprapubic, and right and left iliac or inguinal region. What is the benefit from the study of the region and quadrants of the abdomen? Are used in practice يعني clinical practice for descriptive localization حتى نوصف مثلا presence of mass يعني كتلة غير طبيعية موجودة في البطن. شلون راح نحدد مكانها؟ بهذا راح نقول مثلا it is located, there is a mass located in the right upper quadrant or in the right lower quadrant. Localization of wound, if there is a wound in the anterior abdominal wall. If there is pain, patient complaining from pain, where is it located? Pain, just like we can say, the patient complaining from pain in the right lower quadrant or pain in the right upper quadrant. And also it is used in practice for descriptive localization of abdominal viscera. Abdominal viscera we can define the localization or the position of the liver. It is mainly in the right upper quadrant and part of it in the left upper quadrant. The spleen is located in the left upper quadrant. The cecum and appendix is located in the right lower quadrant of the abdomen. Now we come to an important subject in the abdomen, which is the anterior abdominal wall. Why it is important to study the anterior abdominal wall? Because there are many or a lot of surgical and laparoscopic incision. يعني هنا راح تكون عندنا جروح اللي هي نستخدمها بالعمليات أو أثناء عمليات الناظور. So it is important to know the structure of the anterior abdominal wall. And you know that the anterior abdominal wall consists from layers يعني تكون من طبقات. From superficial to deep, these are skin, superficial fascia, muscle layer, transversalis fascia, extraperitoneal, fat, and peritoneum, parietal peritoneum. So when we do an incision, a surgical incision, the repair or stitching of the wound يعني خياطة الجرح من راح تكون in layers. يعني راح نسوي stitching للperitoneum, repair to the transversalis fascia or posterior fascia, repair to the muscle layer, repair to the superficial fascia, and lastly, we suture or repair the skin. We should know the surface anatomy of the anterior abdominal wall. We can see at the midline there is a midline depression of white color. This is called Linea Alba. Linea Alba, it means the white line. It is formed by the fusion of the aponeurosis of this abdominal muscle at the midline. This is the aponeurosis of this thin sheet muscle, which are the external oblique, internal oblique, and transversus abdominis muscle. Near the midline, they form aponeurosis. This aponeurosis fuse at the midline to form the linea alba. This is the fibrous band that is formed by the aponeurosis of these three thin sheet muscle. We can see that this muscle laterally it is fleshy and medially it becomes aponeurotic, and the aponeurosis of this muscle will fuse at the midline to form the linea alba, which is a fibrous band. This fibrous band extends from the xiphoid process of the sternum to the pubic symphysis at the midline. And the navel or the belly button or the umbilicus is tethered to the linea alba. يعني هنا راح تكون السرة هي ملتصقة باللينيا alba. Another landmark, which is a curved landmark called Linea Semilunaris. Linea Semilunaris. This is the lateral margin of the rectus abdominis muscle. This is the rectus abdominis muscle اللي هي العضلة المستقيمة. Its lateral margin is called the linea semilunaris, especially when the muscle is contracted. It extends from the tip of the ninth costal cartilage to the pubic tubercle. From the tip of the ninth costal cartilage to the pubic tubercle. This is what we call the linea semilunaris. Thank you very much.